board-certified plastic surgeon here in Washington, D.C. I'm former director of reconstructive breast surgery at Georgetown University Hospital, and I'm a member of the Aesthetic Society as well as ASPS, and I have no financial interest related to my comments. I performed over 3,000 breast reconstructions with silicone implants. The cornerstone of my practice is patient choice, patient autonomy, patient education, and shared decision making. There is this concept of calculated risk in life, in medicine, and in surgery. I've used textured implants in over half of the reconstructive operations I've performed. Why? Because in many cases, the benefits of the device outweigh the risks. With the wide adoption of prepectoral breast reconstruction, a textured implant will oftentimes stabilize the implant in the pocket with the use of less surgical mesh. It affords greater implant control, gives a more natural result, particularly in thinner patients with little to no soft tissue coverage. Not to mention the abundance of long-term data that show that rates of capsular contracture are lower in textured implants. And in cosmetic patients, textured implants are beneficial in women with chest wall deformities or women who have recurrent capsular contracture. I implore the panel to give women a choice. Continue to make all implants available to patients. These patients are intelligent women capable of making informed decisions for their bodies themselves. I explain to women that surgery with breast implants is a capital investment of sorts. I explain that their implants will likely need to be replaced at some point, that they need to remain under the care of a board-certified plastic surgeon for life. In my initial consult, we discuss all of the complications, all of the specific risks, including ALCL. Additionally, I stress to each patient, as I do all women in my practice, the importance of a self-breast exam, listening to their bodies, and the importance of routine follow-up. I see my patients at least every 18 months. I follow the FDA recommendations on MRI screening, although I will say it's often a challenge to get women to follow this recommendation, and it's even more of a challenge oftentimes to get their insurance company to pay for the MRI. Finally, I would like to stress the importance of these operations being performed by board-certified plastic surgeons. You've heard from my colleagues from the Aesthetic Society and ASPS the important initiatives that are being brought out. However, to be a member of these societies, you need to be a board-certified plastic surgeon. You've also heard from the implant manufacturer that only sells to board-certified plastic surgeons. They presented their data with the lowest incidence of ALCL and superior long-term rupture and capsular contracture rates. This is not a coincidence. I would ask the agency to seriously consider a recommendation that breast reconstruction and cosmetic breast surgery with implants be performed exclusively by board-certified plastic surgeons. Thank you for your time and the opportunity today.